HIV doesn't know they have it, which is why it's so important to get tested, especially if you have unprotected sex with more than one partner or use intravenous drugs. Here are some signs that you may be HIV positive. One of the first signs can be a mild fever, up to about 102 degrees Fahrenheit. If fever occurs at all, is often accompanied by other usually mild symptoms, such as fatigue, swollen lymph glands, and a sore throat. At this point the virus is moving into the bloodstream and starting to replicate in large numbers. As that happens, there is an inflammatory reaction by the immune system. Night sweats. About half of people get night sweats during the early stages of HIV infection. Similar to the hot flashes that menopausal women suffer, they're also hard to dismiss, given that they soak your bedclothes and sheets. Achy muscles, joint pain. ARS is often mistaken for the flu, mononucleosis, or another viral infection, even syphilis or hepatitis. That's not surprising, many of the symptoms are the same, including pain in the joints and muscles and swollen lymph glands. Fatigue. The inflammatory response generated by your besieged immune system also can cause you to feel tired and lethargic. Fatigue can be both an early and later sign of HIV. Nausea, vomiting, diarrhea. These symptoms can also appear as a result of antiretroviral therapy and later in the infection, usually as the result of an opportunistic infection. Diarrhea that is unremitting and not responding at all to usual therapy might be an indication. Nail changes. Another sign of late HIV infection are nail changes, such as clubbing, thickening and curving of the nails, splitting of the nails, or discoloration, black or brown lines going either vertically or horizontally. Dry cough. A dry cough was the first sign that something was wrong. He at first dismissed it as bad allergies. But it went on for a year and a half, and kept getting worse. Benadryl, antibiotics, and inhalers didn't fix the problem. Neither did allergists. So be careful and consult the doctor as early as possible. Sore throat and headache. As with other symptoms, sore throat and headache can often be recognized as ARS only in context. Cold sores or genital herpes. Cold sores, oral herpes, and genital herpes can be a sign of both ARS and late-stage HIV infection. And having herpes can also be a risk factor for contracting HIV. This is because genital herpes can cause ulcers that make it easier for HIV to enter the body during sex. Weight loss. A person is considered to have wasting syndrome if they lose 10% or more of their body weight and have had diarrhea or weakness and fever for more than 30 days. Weight loss is a sign of more advanced illness and could be due in part to severe diarrhea. To stay up to date with my latest videos and cool tips, make sure to subscribe to my YouTube channel by clicking the button below this video.